Our first bony landmark is our tibial tuberosity. Our next bony landmark are the medial and lateral femoral epicondyles. And these bony landmarks are best seen when the knee is in a flexed position. We will now begin with our soft tissue palpations, starting with the quadriceps muscle, which attaches distally to the patella with the quadriceps tendon and involves three muscles: the rectus femoris, which attaches proximally at the hip, the vastus lateralis, which also attaches proximally to the hip, and finally the vastus medialis. Our next soft tissue palpation will involve the hamstring muscles. The first of these muscles is the biceps femoris, which attaches proximally to the hip and laterally to the knee. The next muscle will be the semitendinosus, which will attach proximally to the hip and medially to the knee. Then the third and final muscle is the semimembranosus, which lies deep to the semitendinosus. Our last soft tissue palpation of the knee will involve the medial collateral ligament, indicated with our blue piece of tape. We will now begin to discuss acute treatment options. Having been through this injury twice myself before, I know that we must first stabilize the knee to avoid any further damage to the structure of the knee. We will begin by using an ACE bandage preferably. However, I only have a resistance band at my disposal, so we will improvise and use this. Once our knee is properly wrapped, we will need a crutch to transport the client. Now that our patient is post-operation, we will begin discussing long-term treatment options. Our first option involves a physical therapy exercise aimed at strengthening the knee muscles, such as the quads and hamstrings, in order to help stabilize the affected knee. Our exercise involves a bent knee position with a resistance band above the knees, with our patient shuffling across the floor, trying to maintain a foot forward position. Our next long-term treatment option involves another physical therapy exercise aimed at promoting stability in our affected knee. This will involve a single leg balance on an uneven surface, such as this pillow. The tensor fasciae latae will start proximally at the hip and transition slowly into the IT band, which will then connect laterally to the knee, which will begin proximally at the end of the gastrocnemius and attach distally to the calcaneus bone.